Have you been having fatigue, muscle weakness, depression, irritability, or maybe noticing your mind isn't as sharp as it used to be? Did you know that these can be linked to low vitamin B12? And I've read somewhere between 6 to 15% of people under the age of 60 are B12 deficient, and 20+% of people over the age of 60 are B12 deficient. Hi, I'm Dr. Carrie Jones, women's health and hormone expert, and today we're going to go all in on vitamin B12 because if that's the nutrient you're missing, how easy to replace it and get your life back. Now, B12 is known as cobalamin, and there are different forms of cobalamin that we will go into. It is considered an essential nutrient, and it is considered water-soluble, thankfully, which is different than like your fat-soluble vitamins. That's your vitamin A, your vitamin D, your vitamin E and K that can build up and cause some issues and probably should be taken with fatty foods or oil. Water-soluble vitamins are very different. They're absorbed different. They are not nearly as concerning on quote-unquote overdose in the body. And B12 falls into that category as the water-soluble vitamin. Now, where do we get our B12? Well, typically we get it, of course, through our diet, although I'm sure some of you are supplementing. Most of the time, we're getting it through our meat. So we're getting it through beef, through bison, through poultry, through eggs, through even through dairy or some fortified foods. So if you are vegetarian or vegan, I'm sure you know that your risk of a B12 deficiency is higher than somebody who does eat animal products, and you're going to want to pay attention to that or at least get some testing. Now, some symptoms of low B12, as I mentioned, are fatigue, weakness, especially muscle weakness, confusion, memory issues, depression, balance issues, difficulty walking, shuffling. We tend to see this, especially think of older than 60 people. They have a higher risk for B12 and they tend to have all of these symptoms, but you can have it if you are younger than 60 as well. And it's not something you're going to want to miss. Now, if you've had a B12 deficiency for a while, you can go on to develop what's called megaloblastic anemia. That is one of the anemias that we use to diagnose low B12. You can also get tongue issues. It's called glossitis. You may even notice cracks or changes at the corners of your lips. And again, your neurologic issues as the B12 deficiency is progressing, you may notice the neurologic changes are progressing also. So again, if you or anyone you know are having these symptoms, it's a very simple test that you can do. Don't miss B12 deficiency. So speaking of tests, what tests are there? Well, first and foremost, you can run a B12. You can run an easy B12 test in the blood work. You can also do what's called a CBC or a complete blood count. And it's between a CBC and a B12, we can get a pretty good idea. Now, there are other tests that I also like to run. One is called a methylmalonic acid, known as MMA. If that's elevated, it tells me specifically you need the B12 known as adenosine B12. You can also run a homocysteine and a methionine, and that also gives me a pretty good indicator of what's maybe going on with your B12. So you don't have to run all of those, but if you're pretty concerned about your B12 or even that whole cycle, the methionine homocysteine cycle, if you have a history of elevated homocysteine, you're going to want to add these markers on, really get pretty comprehensive with your B12 check to see if that's possibly the issue. Again, especially if maybe you're vegetarian or vegan. Now, how is B12 absorbed? Well, thankfully, most of the time we're getting it from diet or from supplements, but we need something called intrinsic factor to help pull it in so we can absorb it. Unfortunately, we can have intrinsic factor antibodies. You can have an autoimmune against your ability to absorb B12. And you're more likely to have intrinsic factor antibodies if you have other autoimmunes such as type 1 diabetes, Hashimoto's, Addison's disease, Cushing's. They tend to run together. In fact, I think the last percentage I read, it's like 20 to 30% of people who have these other autoimmune are also positive for intrinsic factor. So add an intrinsic factor on as well to your blood work if you have any of those autoimmune. If your intrinsic factor is positive, then that means dietary or supplemental through the mouth, like a capsule, is likely not going to work. You may need to switch to B12 injections, and you can talk to your practitioner about that if you have this intrinsic factor antibody. Now, what are some common reasons for low B12? I've already mentioned that if you're not eating it, right? So if you're not getting these foods in, Whether you do eat meat, but not that much, or you are a vegetarian or vegan, that could be a big reason. You may not be absorbing your B12 that well. Again, if you have intrinsic factor, you're not going to absorb it. But if you're also on certain medications that block absorption, such as those that are antacids, proton pump inhibitors for heartburn, reflux, or certain medications deplete B12. So metformin, which is called glucophage, the birth control pill, antidepressants, there's a whole list of medications that are known to deplete B12. If you are on medications, you're going to want to look it up online or talk to your pharmacist next time that you get them filled and ask specifically about B12. And of course, if you have any of those symptoms, also consider getting additional blood work done for your B12. Now, when it comes to B12, you may be asking, okay, well, what does it do in the body? Your B12 is key in two critical areas. One is to help get what's called succinyl-CoA into the Krebs cycle. Now, the B12 for that, it starts with an A. It's adenylyl B12. It's not talked about very often, but again, it's essential. Adenylyl B12 helps your Krebs cycle. Krebs cycle helps you make ATP, so cellular energy. Your other B12 is the more common one, methylcobalamin, methyl B12, and that one specifically works in your methionine or methylation cycle. That helps over 200 methyltransferases do their job. So that one's associated with your muscles, your nervous system, your detoxification, your DNA synthesis, red blood cells. I mean, that cycle really does a lot. I mean, they both do a lot. ATP is so important, and those 200 methyltransferases are so important. This is why if your B12 is low, it's going to impact so many systems in your body. Now, I mentioned there are two active forms of B12, the adenylyl and the methyl, but there are actually 4 forms out there that you can use as supplementation. The first form is called cyano with a C, C-Y-A-N-O, because it has a little molecule of cyanide on it. Before you freak out, it has been deemed safe, it is very cheap, and it has been shown in the research to increase B12 levels. The problem with cyanocobalamin for me is that a lot of my patients already are struggling. They're already struggling with detoxification, they're already struggling with viruses and bacteria and stress and all the things, and I don't want to add a teeny tiny molecule of cyanide into them every single day on top of it if I can avoid it. So I tend to use either hydroxo, which is the second version. Hydroxo is considered the natural form of B12, and it's called natural because it can then convert also into the methyl form or the adenylyl form as well, just like the cyano, but doesn't have the cyanide attached to it. So I tend to like that form better unless I'm specifically going after the adenylyl form or the methyl form. So the adenylyl-cobalamin and the methylcobalamin are the actual 2 active forms in the body. Those are the 2 that are doing all the work. And you might need both. You may need one over the other. You may need, some at one point, some at another point. But I just need you to know there are 4 forms, but only 2 are active in the body. Now, when it comes to B12, again, I just want to reiterate those statistics that somewhere between 6 and 15% of people under the age of 60 are B12 deficient, and 20+% of those over the age of 60 are B12 deficient. So if you have not been eating or don't eat a lot of foods that contain B12, if it's been a while since you've had blood work, if you're having any of the symptoms that I talked about, if you have the autoimmune conditions I talked about, type 1 diabetes, Hashimoto's, Addison's, Cushing's, you may want to ask your practitioner if you can get some of this blood work, a CBC, a vitamin B12, and consider adding on the intrinsic factor antibodies, the methylmalonic acid, homocysteine, and or the methionine. Because if it's just a B12 deficiency, that is so easy to fix, and you can get your health back. You can get your life back. And especially if you know somebody who's over the age of 60, especially somebody who is maybe even over the age of 70 or 80, and they're struggling with these symptoms, make sure B12 has been tested for them as well. Shuffling, memory issues, fatigue, depression, it kind of gets blown off as, well, that's aging, when it could be a B12 deficiency. So I hope you learned a lot. Again, hit that subscribe button. My name is Dr. Carrie Jones. I'm here to help you learn all about hormones and all the things that go with hormones, such as B12, because I know it can feel like herding cats.